My name is Steve Merrill. For more than 2 decades, I headed the Science, Technology, and Economic Policy program here at the Academies, and last year I stepped down from a second job as Executive Director of the center that Artie chairs at Duke Law School. And even before that, I was a Senate committee staffer in the Bayh-Dole era. So I've been involved in these issues for a long time. My role today, and privilege today, is to chair a panel that will address 3 issues. So the first is what improvements have been made and are still needed in the process of transferring research results funded by NIH, either internally or externally, to private sector development, testing, and marketing. And just as a reminder, the external part of that portfolio is governed by the Bayh-Dole Act of 1980, which allows universities, nonprofits, and NIH contractors to assume title to their inventions and to license them to private parties. The internal component of that portfolio is very loosely governed by the Stephenson-Whiteler Act, also passed in 1980, which simply directs federal agencies to develop the capacity to patent and license their inventions. So that's one set of issues. The second set of issues is a bit more controversial, and that is, does NIH have any role in controlling, moderating, or reducing drug prices? Now, you heard this morning a definitive answer to that question, which was negative. But there are some who disagree, not only NGOs, but also, very recently, the editorial board of the New York Times, several members of Congress, and at least one of the presidential candidates have argued that the NIH should exercise its authority under the Bayh-Dole Act to march in and compel the relicensing of an invention if, under circumstances related to public access on reasonable terms. All that's occurred within the last month. So to some, this is still an open question. The third issue that I want to discuss would not have been on this agenda 10 years ago, and that is, what is patentable? Now, from about 2000 to 2011, the nation went through an extensive debate on reforming the patent system, resulting in the American Invents Act of 2011. The Academy was a prominent part of that discussion, but nowhere in that discussion was the issue of what is patentable. So what's happened since? Well, the Supreme Court stepped in, and a series of decisions resulted in a standard, quote unquote, a standard that curtailed the patenting of some biomedical research inventions and especially important computer software developments. So now a lot of people, including a number of members of Congress, think that the Congress should legislate a new standard of patentability to expand the realm of patenting, or at very least to establish a greater certainty about what is patentable.